Hello, everyone. Welcome to another episode of Elevate, where we have two special guests today, Ghazal and Gulrukh. It's a pleasure to have both of you. Would you like to introduce yourself? Probably. Ghazal, do you want to start?
Yeah, sure. Hi, everyone. My name is Ghazal Fazli, and I'm an assistant professor at the University of Toronto Mississauga campus. I am based there and I do research on type 2 diabetes, specifically looking at the social conditions and the environmental conditions that shape individuals' health and well being. And aside from the workspace, I'm a dog mom to a puppy named Leo, and I have to say I'm very grateful for being here today and being able to, um, share this platform with so many incredible individuals who have shared with before, and being with Gulrukh here and yourself to talk about women's health, health advocacy, health equity, and looking forward to diving into that.
Beautiful. Thank you so much, and welcome once again.
Thank you.
Thank you so much as well. My name is Gulrukh Ladha, and I'm a manager of cancer screening and prevention at the Mississauga Halton Central West Regional Cancer Program based in Mississauga. My journey into this world really started with like a simple belief that early detection is really, really important and it saves lives. And, I wanted to be part of the solution. Like, how do we provide accessible cancer services to people in our communities? So, every day I get a chance to work with passionate, amazing people, and everybody's goal is the same. Like, how do we make cancer screening easy? How do we make it accessible? How do we get out there in the community? Outside of the professional world, I am a mom to two little girls, and I think that also really drives my why and my purpose. I want my daughters to grow up in a world where they know that they can prioritize their own health and they can be empowered. And I think women's health is often neglected based off of the world that we live in. And so I just think it's really, really important to be a part of this, and so that I can teach my daughters in our community like how to be out there and care about yourself and prioritize yourself.
That is so important, and welcome once again.
Thank you.
You've tapped on the topic that we're going to talk about today, so it's a pleasure having both of you once again. So, Ghazal, you've been an immigrant to this country, a newcomer essentially. So, how do you think your personal experience helps in shaping your passion for health equity?
Yeah, no, that's a great question. I think it's important to be self aware about your positionality when it comes to talking about health equity. My family arrived from Afghanistan, and through various challenges, as many immigrants share, of navigating a new world. Despite my parents being educated and being doctors, they had to take up whatever job they can to make ends meet. And this is a narrative that many immigrants share. And so, as a first generation immigrant, trying to escape war in a conflict zone, and coupled with coming from a place where access to education is denied to women and girls, that in itself really it fuels you with a sense of purpose in life. And so throughout my experience and growing up in Canada, navigating new worlds, new adventures and new opportunities, I realized that not everybody has the same starting point. Not everybody has the same. We can collectively say that we share, there's common threads in our stories, but we all come from a different context, different environments. Our traumas are different, but very shared. There's generational trauma in so many ways, especially from countries right now who are continuously facing conflict. So, you coming to Canada, health equity was really an idea where it made sense in every way, but it's not easy to accomplish because not only are we coming from a context that's the pre-migration experiences, it's the post-migration. There's lack, at least when my family arrived, the number of services that are available today, they were there, but they were scarce.
Right.
Access to, jobs and careers and opportunities, connecting with the community, cultural understanding and sense of belonging is really something that over time you realize how important it is. But it wasn't always there for us. So my parents had to take up any jobs they can. Growing up, grocery shopping was very different for us than present time. So all of this, my experiences over time, has really fueled my own passion to unpack health equity. And of course, being in a space of chronic disease prevention, you know that it's very multi-layered. Yeah. It's your experiences as an immigrant, it's the resources that you have access to, it's the distribution of wealth, power, resources, and then the conditions that we grow and live in and so on that shape our health every single day. What we can afford, what we can't afford, what foods we can bring to the dinner table, what programmings and services that we can access. So for me as an immigrant, I want to put a positive narrative to it because I am grateful. I've been very fortunate and lucky to be given the opportunities that I have been given, but it also fuels me with the passion to figure out how can we now provide these opportunities to others and shape their lives. If we all play our role, in smaller ways, I think we can all collectively reach that common goal.
That is such a beautiful thought, though. I'm an immigrant myself. Like, I'm a newcomer here to this country, and I can relate to the fact that it takes a little while for you to feel home.
And sometimes it might never be.
You're right, actually.
I'm an immigrant too. Like sometimes that sense of belonging, or your feet are in two different worlds all the time. That sometimes you don't get over that. So.
I agree with you. And it's just that we want to find that sweet spot.
Yes.
And and be in a space where you're trying to get the best of both the worlds, but then you find your own way of making it the best and making it your home. Gulrukh, you yourself also have extensive experience in health systems and health equity. Why do you think that creating awareness is important and it is such a powerful tool, especially when we talk about fighting breast cancer?
I'm gonna go to like the simple saying that like you only know what you know, and awareness is extremely powerful because it's the first step to action. If you don't know what services exist out there, or how to screen, or who to go to, and you never do that, then you end up in a situation where you're further down the road and your disease is far advanced. In our region, in this area, in Mississauga, Halton, Central West, I would say 60% of our community are those who English is not their first language. They've immigrated from another country, similar to kind of what Ghazal is saying, different traumas, different cultural experiences, war-torn, refugee, or people who have had, a very simple and positive life experience, but are still coming to a new country where they don't know where to go grocery shopping. They don't know where to access a physician. They don't actually know that you need a primary care provider. And so I think, in our community, people face language barriers. There's cultural barriers. There's socioeconomic barriers. Like, how do I get off work? How do I have childcare so that I can go to a site and get screened for breast cancer? Like, some of these things just don't exist for marginalized people in our community. And that's why health is not a priority. Like, you just say, okay, like, I gotta put food on the table, I gotta get my kid to school, I have to attend a shift at work that's at night, and so, like, I don't have time to get screened. It's fine, it's okay, I'm okay. And women in our communities do this more than anybody else. We prioritize our partners, our children, our parents, the groceries, the food, and then we're like, oh, okay, I should get this thing checked. When we raise awareness, I think we're not just sharing information. We're helping people understand why screening matters, where to go to get screening, who to call, and the fact that this early detection can truly change the course of your entire life. And people just don't know this. And I was going to say, from a health system level, it's really important because we need to understand it sheds light on the inequities that exist, and it sheds light on who we're leaving behind when we don't look at the system in a holistic way and look at, okay, there's people from different communities who require a different targeted approach to how we're going to go about this. So I don't think awareness is just knowledge, and especially when it comes to breast cancer, it's empowerment. Like, it's letting people know that you can take health into your own hands, and like, you can change the course of your life.
That makes so much sense. And I love the fact that you said that awareness is empowerment. I am going to take that with me for sure. And yes, you're absolutely right, because there are people who well, as I said, like, I'm a newcomer myself. So I did not know that you actually had to have a family doctor to go to a specialist. Let's take the basic example. And when you don't know, you might read online. You might read a lot of things when you're planning to move to a different country. Agreed, you have a plethora of information out there, but then there are some things which are so you don't know until you be there, sort of a thing. Like, as you both of you pointed out, grocery shopping. Where do I get X or where do I get Y from? I might go to a shop which would be right next to my apartment at home, back home, but then here I actually have to go, like, I have to drive to a grocery store to actually get this. You know what I mean?
Back home, you had a village.
Yes.
You had a community, and here you came, and I came when I was 17, and I didn't have a village. So now it's like, where do I leave my child when I need to go for an appointment? Or what do I do if my child is sick and I can't get a day off work? Like, a lot of people who have newcomers to this country, they don't have these facilities. And so because of that, when you're in a race to survive, then these things like, should I go for screening? It's just prevention.
Agreed.
It's not, that's what in their mind, it's like, I don't have cancer. Like, I could get cancer, but like, do I need to, like, shift my day or shift my schedule or deprioritize this to go get screened? And I think that is the education that, like, my work is really focused on, that we need to do is, no, you have to get screened, because this is going to change everything. It's going to change you, it's going to change your children, it's going to impact your whole life.
You're absolutely right. And that's where, coming to the point where it's really commendable for what you're doing, because yes, you're absolutely right. Women have a tendency to put themselves on the back burner, which is something which impacts them on the long run. Which, that's the thing, like, we are how do you say, we are designed in such a way that it comes innate. So naturally. Yes, it's so innate, right?
My friends and I always say this, like, why is it so easy for our husband to say that he has to go to the gym or he has to go for a dentist appointment, and we're like, asking like a couple of days in advance, can I arrange my schedule? How do I reschedule this, that, and the other to go to this appointment? And nobody told us that we had to do that. We tell ourselves that, like, everything else is more important than yourself. And it's also a cultural thing in many communities, and that's the shift, I think, that needs to happen in order for everything.
I think in so many ways, like, you hear things like sacrifice is love. So the more you sacrifice yourself, the more love you show. And especially if you're a daughter. I have a family with 3 boys and a younger sister, but the daughter is the one that's responsible for managing appointments. Sorry, Mom and Dad. I'll make sure they don't listen to this. And my siblings.
But I'll edit that out. Okay.
You're going to take Mom are you going to Mom's appointment? Are you going to take Dad's appointment? Or are you going to... And it's like, okay, let me just shift school. Let me shift work. Let me shift everything, because I got to be there, and you got to go prepared for those appointments. And then you transition one day to becoming a wife, or a mom, and then suddenly you're doing the same thing but 10 times more. So the more sacrifices you make, the more you love. The more, our responsibilities become our badges. It's like the more badges we have on us, the more of a hero or superstar we are. And sometimes growing up, I would sit and hear my mom talk with her friends, and the conversations were always about, it's like a competition of how much you're doing for others.
Yeah.
And it's like, I don't like that. And I remember I became that, and sometimes I have to self-check myself because then I'm my mom.
Yeah. Oh, of course. Yeah.
And then I'm like, oh my gosh, I am her.
Totally,
and it compounds over time, right? So it builds and builds and builds, and then your allostatic load, as they say, increases. And then
I love what you said about badges because even at work, like many years ago, it would be like a badge of honor to say, I don't take sick days. I don't take personal days. I work 12 hours a day all the time, and how much is it that I can do? And there has been a shift in even corporate culture to understand that everybody needs time for themselves.
Yes.
You need to take that appointment. You need to do these things like the flex culture, all of these things. But we have to remember that there's only, I would say, probably not even like under 10% of the population of Canada who has access to that flex corporate culture.
Absolutely.
That says, you have benefits, you have sick days, you have this. The other rest of the country who don't have that, they're working, and so they're now not going to be able to get paid when they're taking a sick day or go to the dentist and just cover it on their insurance. Everything is out of mind and out of pocket, and then you prioritize differently.
And that's hard, honestly. It may be anyone in that case, but it's difficult, especially when you have to put yourself on the back burner. Not fun. We're talking about creating awareness. We're talking about creating a space where people realize that they shouldn't put themselves on the back burner and prioritize themselves. So, Ghazal, what do you think would be some effective ways to reach women, especially those facing cultural, language, or even economic barriers? Do you want to talk more about that?
Sure, and I'll talk about this in the context of type 2 diabetes and give an example of what we are doing. When we talk about, Gulrukh talked about early detection, and it's whether you're talking about dementia, diabetes, cancer, mental illness, pain, right? We often miss these important things that women experience over the course of their life. One thing that I would point out is that early detection is important for anything and everything. Our bodies give us early warning, but we don't really know those early warnings. In type 2 diabetes case, there's your blood sugar levels elevate, and it's a pre-diabetes stage. And so many women or individuals, for that matter, could be in that pre-diabetes stage. It's not a diagnosis of a disease per se. It's a risk factor, but it's your body saying like, hey, something is not right. So tons of evidence and out there, and studies have shown that with adoption of healthy behaviors and changing diet, nutrition, you can reverse that. You can go back to a normal glucose level. That's great. But now we're talking about all these challenges where it's not possible to adopt healthy behaviors. So how do we do detection and screening in a way that reaches women? So what we've done in Peel region is we did a lot of consultations with the community partners, organizations. Dixie Bloor Neighborhood Center is one of our community partners on this initiative, where we did community-based screening. And so this summer, what we did is we piloted a small-scale intervention where we went into the community through health fairs and did glucose testing, risk assessment, questionnaire, followed by connecting individuals to primary care, especially for those who don't have access to a doctor, giving out some educational materials and so on. So we learned quite a bit. What we discovered from that, and what we want to do in our phase 2, is that we can't ask, it's kind of like the same model, asking people to come. We need to take screening to the community. We need to take it to familiar, trusted places where women feel connected, feel empowered, whether it's a faith-based center, whether it's a community center or school, or even the grocery stores, right? Wherever spaces allow us. We need to invest in those types of solutions, because as long as we depend on people coming to the healthcare system for whatever it is, guess when they're coming? When they're not feeling well.
Yeah.
They're not going to come to the healthcare system because they feel lovely.
No.
When was the last time you're like, oh, I haven't seen my family doctor in a long time. I wonder how
Let's
he's
just
doing.
go get a checkup.
You know what I mean? Or wonder exactly. You often do this because you're not feeling well.
Yeah.
And by then it's missed opportunities. So there are critical windows where we can revamp these interventions and solutions and bring it to the community. So we're trying to figure out how to do that right now. Of course, you need, buy-in, you need funding, you need support, you need a lot of people on board to make it happen. We learned a lot how much it costs, how much resources it costs, and personnel and time, but it's possible. What we found is that it's possible. The other thing I would say about screening and education, we miss the opportunity to do more peer-to-peer, women-to-women empowerment and engagement. We talk a lot about this, how much it matters in different spaces and so on. My brother golfs a lot, and that's his circle, and that's his therapy, right? So when we talk about how do women do therapy, we talk on the phone, we socialize for hours and so on. We share our aches and pains and highs and lows. But imagine if we implemented an education awareness, whether it's cancer or diabetes, and actually established a women-to-women, peer-to-peer network where women actually talk to other women, go into the community, women who represent the identity of the women we want to impact. It's always the unheard from, the voices less heard from. It's often the women who are too busy, too occupied, may not understand the language, who are falling through the cracks. And I think the final piece I would add in there is it's not so much about changing the women, because sometimes education, if we say we need to do education, we're putting it on the women, and sometimes you have to be careful about victim blaming in that sense. People overall, when you look at trends in disease over time, people understand more so now than 50, 70 years ago about the benefits of exercise and healthy eating.
Yeah.
No one's going to deny that. YouTube's doing a great job, although sometimes it can have some questionable videos on there. But I think we need to change the systems that surrounds us.
Right.
We are now required to go to work, right? So what are some interventions and solutions that can happen in the workplaces?
Right.
It can be from economic policies that reduce, the inequities and pay gaps, policies that empower women, interventions in the workplaces around screening and so on. Even if employers invest just a little bit, into that, I don't have the statistics in front of me, but if we want to talk about productivity, economic growth, we want to talk about, hitting all those pillars. Healthier women means healthier families, healthier communities, healthier economies.
Absolutely.
So it's possible.
It is possible. No, definitely. And I would like to actually ask the same question to you, considering we're talking about awareness, because what do you think, especially when we talk about breast cancer, what is your take on creating that awareness, and how do you go about with it?
I think when we talk about awareness, there's so much more that the system can do. There are a lot of barriers that are individual and personal to people, but there's a lot of barriers to the system. And I think the biggest one that Ghazal mentioned is that we are expecting people to come to us. And that is an extremely big barrier and challenge to access to care. I think when it relates to breast cancer, there's a stigma in some cultures and societies about any kind of physical ailments that a woman might have, whether it be breast cancer or cervical cancer. Something is wrong with you. There's something that goes on in their mind that makes them avoid these types of topics. And so awareness is about broader education, and education is not like I'm going to read a book to you and teach you about what you're doing wrong. But it's more about opening up people's minds and saying it is okay to prioritize and educate yourself, and these are the things that you need to look out for and be watchful for. At our regional cancer program, a lot of what we've done in the last couple of years is we've translated all of our materials into 10 different languages, because we know that there's 10 top languages in the Mississauga Peel areas that people speak. We often go to these community fairs and wellness centers, and we bring someone who speaks the language of the group that we might be speaking to, because a Muslim woman in the community may relate better to another Muslim woman who's wearing the hijab, who speaks Arabic and can tell you about her experience, or somebody from the Caribbean might relate better to another Afro-Caribbean Black woman who's experienced this. So I think being culturally sensitive is also really, really important. The other thing that I would say is ultimately healthcare systems really needs to move away from this like one-size-fits-all approach. Like everybody's different. We have to customize our care. And so for us at the Regional Cancer Program, that means like I said, languages, multilingual campaigns, but it also means like mobile screening, buses. It means organizing like screening blitzes, which is like, an Ontario breast screening program site. We're going to make it. We're going to work with them so that there's going to be a day where nobody needs an appointment. Come in at any time. Anytime you come in today, we will take you and we will see you. And that takes away that anxiety that mother, that woman that faces in the community, that I need to be there at 4 p.m. Need to leave work at 3. No, just come in. You will get screened today. So we're really trying to do a lot more of those types of things. Because that is, like somebody once told me, meet us where we are at. I think, I don't know, this is another community partner we work with, Rexdale, who said that. And, Dixie Bloor is a really great example. We've been invited by you guys to the knitting circle. And Ghazal, as you were saying, like women, they speak and they share their aches and pains and they want a common hobby. Going to this knitting circle was great. There was women from all faiths, all backgrounds. They were newcomers to the country and they were sharing a common purpose. They wanted to learn how to knit. And they were doing that over some tea and some snacks. And then we came there at the Regional Cancer Program and said, hey, while you're doing that, let me tell you about this important thing that you need to do. And you and your organization gave us the platform to do that, but we need more platforms like that to just be in the community. And also, Mansi, I think we have to remember, like I said, 60% of people within this region are newcomers to Canada at some point in their life. And health systems in other countries are not focused on prevention. They're focused on when something is wrong, you go to the doctor. And maybe it was like that in North America too at a time. But the shift here has become more about prevention. But where many people are coming from, there wasn't that concept that you go get a physical done once a year, or you check for pre-diabetes, or you check for cancer. It's when you feel unwell is when you go to the hospital. And unfortunately, often it is too late. And in a system that's burdened by capacity challenges, increased wait times, physician shortages, we need to give that information out there so that people can take control of their own health, because the system does not have the capacity to go out there and support every single person. But people like me, we have that in our hands to go out there and do that. Community empowerment is really important.
Absolutely. And that makes so much sense. To add on to your point, Ghazal, when you said about women don't have the time to get diabetes. I recently got my blood work done. That too after a lot of push from my partner and be like, it's high time. You better get it done. You have the requisition right in front of you. Just go and get it done. But then, I mean, in my head, I was like, oh, I need to drop off my child at this time, and then I'll leave at this time. Only then I'll be able to make it on time at the for my blood work appointment. And then it's just, if I go for a walk-in, then it'll take so much time away. And that entire process of is so stressful that I just feel that if numbers have gone fluctuating on in my blood work, I will be surprised.
I don't know how many requisitions of blood work I have that I just haven't done.
Yeah.
And I work in healthcare, in the hospital, in the cancer system, but it's to your point. Like if I don't get to the clinic before 8 a.m., I'm going to be on a 110-minute wait list, and then I have to get to work, and then after work, I got to pick up the kids.
Exactly.
And so you just say, okay, I'll get to it. Like nothing is wrong.
Yeah,
and
yeah.
that nothing is wrong can become something is wrong.
Absolutely. And that's where it's really amazing what you are doing, Gulrukh, about making the time open for people to come when they are available. And I think that's really commendable and fantastic. And that is a great step for women to be more comfortable and find their own time.
Yes.
Because they need to find their own time.
Right.
It's hard.
They do.
Absolutely.
So, awesome. Okay, do you? We've actually spoken about the fifth question that you want to talk about, that women delay screening and medical visits. Do you want something more to talk about it, or
I mean, I think the only thing that I would say is like work. We have to create. We've already talked about it, but we have to create like practical and supportive solutions.
Right.
So it's the mobile clinics are a really good example. Yeah, extending and having flexible clinic hours and flexible hours is really important. That's great, but sometimes people still can't get to that appointment. So one of the things I learned through another community partner, they go into community housing and they bring a nurse practitioner with them. And the nurse practitioner, people will come down and people know this community member now, and so they come and the nurse practitioner will say, okay, here's a requisition to go get your pap test, here's what you need to do to go get your diabetes screening.
Yeah.
That's also like a way to meet people where they are. It doesn't have to be at like a clinic or at the hospital. And I think that we also have to understand and perceive that sometimes people are scared of that Western medical concept. Like there are barriers to even entering the hospital in many, many people's lives. They've experienced injustices, they've experienced traumas at the hands of this whole system, and so they don't want to go there. So how do we reach them? I think that's really important. So we're trying to partner with some of our community partners who are going into these community housing and saying, okay, can I tag along? Like, I'll educate about cancer screening, we'll bring some services, maybe that way people will build a trust in us. And I think trust is the biggest component, and that's also a big barrier to access.
No, that makes so much sense, because when we talk about this tagging along, you're so right. Because when after my delivery, I had the benefit of having community nurses who would come home to help out with any and everything that's needed, and they had somebody who had tagged along with them talking about cervical cancer. So it was interesting to, well, I know you're overwhelmed with just having delivered a child and all of that. Yes, I understand. But the way how they speak with you, and they kind of make you understand that why it's important to get it at the time when you need to get it, it was really, really helpful.
I would say cervical screening is a really big example. If I'm saying that so many people in our community are newcomers, this concept of going to a physician and doing a pap test is very uncomfortable.
Yes,
It's very
absolutely.
foreign. And in many cultures, having a male physician who is now you're going to expose yourself as a woman in that way doesn't feel comfortable. Now, can we move past the stigma of this? We're trying. But this is an example of something that we're exploring in our region is self-sampling. So we're trying to provide physicians' offices with something called a self-sampling kit. And so Ontario Health is taking this initiative, and they're piloting sites in the region. And what they're doing is that means that a newcomer to the country who does not want to go to a male physician and do a pap test can go to her family doctor, and they can give her a little kit, and she can take it home. Or she can go to the washroom and she can self-sample. It's very simple. It's like a COVID swab, but it's a sample of the cervix, and then they'll give it back, and then it'll go for testing. That is a true example to me of meeting people where they are and understanding what the barrier is that exists and breaking down that barrier.
Yeah.
I can have the clinics open for 12 hours a day, but if the woman feels that she cannot go and get a pap test done or an HPV test done by a male physician or any physician by that matter, because it objectifies her, it invades on her personal space, whatever her cultural beliefs are, no matter how many hours that clinic is available, she will not get screened.
No, you're so right.
So what else do we do and how do we move? That's my answer.
That is such an amazing initiative. And, well, honestly, I don't know for I know I'm sitting with two people who are talking about healthcare and they're in the industry, but then I myself feel uncomfortable about the fact getting a pap test done.
Yeah, and it's painful.
It's painful.
It's very
It is.
painful, you know.
Oh.
The other thing I just wanted to add to what you were saying is I moved to Canada when I was 17. I grew up with two parents who are physicians, similar to Ghazal, very educated, very empowered. I have been in Canada for 20 years. I'm still culturally, I don't know what the word is, like
Programmed?
culturally programmed to think like I should go to a female for my
Oh yeah,
pap test.
that's a thing.
That's the
When
thing,
I
yes.
had my daughters, I wanted a female gynecologist.
Yeah.
And my husband's like, you know, it's okay. Like, you know, and I was like, I know it's okay, but I think I would feel better. And I'm not a newcomer. I didn't
Yeah.
move here in my late 30s. I came from, you know, a life of privilege and had all of the benefits of the education, but the cultural beliefs still are strong. So we've got to not think about it's not like you have to take this out of people or fix this. We can't fix this. There's nothing wrong with it. We just have to adjust and provide solutions and access outside of it.
And I think it's okay to also validate women to say you shouldn't think that way.
Yeah.
Because it's very difficult to shut that off, and I'm talking about, you know, just a generation older, like it's just or even same generation as us. It there's no point of trying to change them to say, well, you shouldn't think that way.
Yeah.
That's a wrong way of thinking. It's more like, okay, that's fine, totally okay. Let's figure out how to work around it.
Work
how
around
you said
it.
about the
The
self-test.
self-test.
It's
Yeah,
also,
that's
as you
amazing.
rightly pointing out, conditioning, right? And also, I think it also comes with experiences.
Yeah.
There are people who come from societies or places where they have faced a lot of maybe traumatizing situations or they've been around with people who have not made them feel comfortable.
Yes.
And that being the reason why they kind of even when a male doctor is also trying to help them, but the same way as a female doctor is, but then they feel more comfortable there.
Yeah.
Yeah, and I think it's just about understanding all equity deserving groups. I mean, we had a presentation at the Regional Cancer Program a couple of years ago about like LGBTQ plus care, and you know, being sensitive to those differences and those needs and what people in that space, you know, perceive their traumas when you associate different parts of healthcare. You know, so I think it's about the shift has to be, like I said, like it's not a one size fits all. It's not what's right for Ghazal is what's right for Gulrukh is right for Mansi. It's let's try to come up with this holistic, inclusive approach that allows people to be their whole self and bring their whole self to
I love that. We've talked about being inclusive. We're trying to bring the health system in a way where we reach people where they are. We reach women where they are. But then now, how do we prioritize women to shift their mindset from the getting off the entire guilt aspect that, hey, I need to take care of myself, also bring yourself back from the back burner to the front burner. Would you like to talk a little more about it, Ghazal?
Sure. I think of like the story of, you know, we've all been on a plane where you get your flight safety measures shared, right? And they always say, if an emergency happens, the mask will drop. Put on your mask first before you put on somebody else. And then often, if you notice in the videos, they'll show a mom and a child.
Yes.
And what will a mom do in that situation? I always think of it. I'm like, yeah, right. I'm putting the mask on my baby first,
100%.
right? But there's a message there, right? If you want to make it for them, if you want to be able to help them, you got to put on your mask first.
Yeah.
So I think that's the narrative that we need to take, is that taking care of your body, in my culture, sometimes it was like considered indulgence.
Luxury.
Luxury. Really loves to take care of herself. And it's like suddenly taking care of herself is an indulgence, and it's not. You have to take care of yourself. And I think a lot of it has to do with us women creating that empowerment circle where we have to get on top of it. Think of indulgence as not an indulgence, but a responsibility towards yourself, where self-care is very important. I bought a face mask that's now fully dry because I've not had a moment.
How many
I don't even know how many masks by the time I get to it, it's expired. And I'm like, well, darn, bringing you back to health. It's all connected.
It is.
In so many ways. If we're going to for me, I'm like, if I'm delaying putting on a mask, I'm delaying going to my physical test.
Oh, for sure.
I'm delaying doing the self thing, which I'm interested in learning more about. I'm delaying getting my blood work done, right? Because if you don't go at 8 o'clock, well, there goes my day. And I don't have time for 2 hours in the waiting room type of thing. So I think the narrative needs to change. And I think that change needs to happen, of course, within, but I think it needs to happen, as we talked about earlier, on the systems around us. But so much of it has to do with normalizing taking care of ourselves. Whatever your self-care is, normalizing that as much as possible. That's a key step, I would say.
It definitely is. What about you, Gulrukh? What is your take on it?
I feel like we've touched on it a lot in this, but something Ghazal said, and I've heard this before as well, is a healthier, educating a woman educates a family. A healthier mom means a healthier child, means a happier family. And I think that's the type of education that I think we need to start moving towards.
Both of you guys have actually tapped on such amazing examples, which makes so much sense for anyone to understand why it's important. The flight example, fantastic. It's something that we see regularly. Like anyone who's traveled on a flight knows this. And if you don't, please check on YouTube. You'll definitely find a video. So, but it is so true. Trying to feel a little less guilty. I think that's the take I think all of us would agree on, that we want everybody to take back with us. As women leaders in public health, what does strength in every story mean to each of you? So, Gulrukh, would you want to?
I think it's deeply personal. The statistics these days are like 1 in 2 people will get diagnosed with cancer. And so I think it's really, really important to reflect on those personal stories and personal experiences. Everybody knows somebody who is being touched by this chronic disease in some way, who has experienced it. And I think if we take a more like holistic approach to understanding women, understanding the barriers that they face, providing them with all of the things that we've talked about, access, information, education, flexibility, then maybe we would be able to avoid some of these things or catch them at an earlier point. It shows us where the system is succeeding, but where it's leaving people behind. And what the gaps are and what we need to do.
That makes sense. What about you, Gulrukh?
I think for me, it's recognizing that lived experiences are powerful tools for change. And what that means for me is that when we recognize that it's not as easy as saying, go get screened, when we recognize it's not as easy as, sharing the information and assuming that they're going to take up on it, or giving them a requisition and they're going to take up on it. They're not, because their lived reality is different. Their everyday life is different. There's a reason why there's missed opportunities, and us being in this space, we have the chance to change that. We do need to go outside our comfort zones. We need to disrupt the current system And we are doing that in so many ways. But, you know, there's the data, but policies don't happen overnight. Change doesn't happen overnight. Suddenly, it's not like, oh my gosh, we need to do something. And sorely speaking, often policy changes happen because something really drastic took place.
Yeah.
And that's how change has predominantly in terms of like the speed at which has happened. You know, it shouldn't take a tragedy, it shouldn't take a catastrophe or chaos to see change happen. And we have to recognize that it's going to happen over time. It may not happen today, tomorrow, but over time, this change can happen. But we need to disrupt these systems. We need to create platforms for voices that we often don't hear from can come together. And we need to continue on this journey. You know, take the challenges, learn from them, you know, and keep going because there's so much work that's ahead of us.
Yeah, so that's so right. Because when we talk about policies or when we talk about bringing out the word, it's important to understand where people are. So I think even giving that platform for voices would even help in other aspects.
Obviously, from an economic standpoint, right? Money matters to policymakers for sure because they want to know where should they invest scarce resources.
True.
Right? So from a health economics perspective, how can we together, collectively, come together to provide, whether it's the voices, the data, the narrative, that us, by investing in these solutions that are more practical, feasible, sustainable, and it could reach the community, how much money do we save in the longer term? And I'm not certainly the only one and the first one to be talking about this, that primary prevention is so important and it's key, but we need to demonstrate that in some shape or form to our policymakers why investing early will save us money down the road.
And I think the health system isn't, it's just not designed like that. It's not designed, it's designed as a treatment as opposed to a prevention. And that, if we slowly, the shift is coming,
Right.
You know, we're talking about it, we're talking about all of the things that we're doing, but if we move towards more of a, how do you prevent?
Yes.
And that prevent isn't only in screening, it's in healthy eating, it's in exercise, it's in mobility,
systems,
it's in the whole thing, it's in
Yeah.
having healthy relationships and a healthy community. If we move towards that, then maybe we move towards, to Ghazal's point, like, we're not spending money treating, but we're spending money educating and preventing.
Yeah, that makes sense. Awesome. This is so enlightening, I must say, and this makes so much sense, honestly, because you what do you say? You nip it at the bud, right? It's like that. Awesome. That brings us to the last segment of our podcast today. So, and I love this segment, honestly, because if you get a chance to go back in time and give an advice or say something to your 16-year-old self, what would it be? Do you want to start with it, Gulrukh?
Sure. You know, when I was in high school, when I was 16, I was so caught up in insecurities and in, like, being accepted by others. You know, fitting the mold of what it is to be like a cool girl in high school, you know. If I would go back and tell myself, you know, now I would say, none of that matters. You know, be you. Let the world see who you are. Don't hide yourself. Don't, you know, let yourself be confident in everything that you have to offer, and empower yourself. Your voice, your presence, like who you are, it matters. And I think when we talk about all of this, healthcare and access and women, so much of women's lives are meant in making ourselves smaller. You know, we want to leave space for the male figure in the family. We want to leave space for the parents. We diminish our voice, and in doing that, you know, we squash ourselves a little bit. You know, if I were to tell myself, you know, like, don't squash yourself, like, be who you are, empower the next generation, make
Spread
space,
your magic.
spread your magic. Yeah.
Beautiful. Well, how about you, Ghazal?
I mean, it's interesting because I had to really reflect to take myself back to my 16-year-old self. And I think at that time in life, um, my parents, being in the medicine field, it's like the pressures, like that you have to also become,
Oh, yeah.
Right. Yeah.
and like it was,
Yeah.
yeah, and it was more like my dad was a dentist, mom was a dentist, and my dad would be like, "Oh, I have a clinic, so you can come and learn." And like, literally, this is all given out to you.
Yeah.
So, but I struggled. I struggled because I was constantly trying to figure it out
Yeah.
while trying to figure myself out. And I wish I could go back and say that this uncertainty, this complexity, everything you're facing is going to fuel your purpose.
Yeah.
Just be patient. And I think sometimes I need to tell myself that still.
Oh, yeah. It's a constant,
It's like
yeah.
literally I wake up this morning, it's like, be patient.
Yeah.
We're always trying to figure things out.
Yeah.
We're always trying to solve and not only just our own stuff, everybody else's
Well,
stuff.
yeah.
And I think looking back and looking within, that one thing that I would tell myself is that those challenges, those uncertainties, they were okay. And I wish I was more present. I was constantly trying to figure it out.
Yeah.
Sometimes I dimmed my own light
Yeah.
because I needed to figure it all out.
Right.
And I feel that one message I would pass to, my niece who's 15 years old, I see her doing what I was doing,
Yeah.
and I would tell her, I'm like, you're dimming your light. You're magic.
Yeah.
Be you, like
You
you
know,
said.
and I think when we bring it back to the whole concept of like, strength and empowerment and health, I think everything that we've said today connects so much, because if you dim your own light, and if you don't make space for yourself, and if you diminish or squash yourself, then you don't prioritize yourself.
100%.
Yeah.
Then you don't go for the healthcare, the self-care, the things that you need to do. Then you can't be present for yourself because you're present for others, and then we see the challenges that we're seeing today. So like it all comes back down to like teaching our youth and the next generation that when you're taking care of yourself and you're happy, then everything else will fall into place. And and not to the expense of others. Like, we're going on a way too much of a woke movement these days, that it's like, it's only about yourself, and it shouldn't be that, but it should be making sure that you've prioritized you as well in this whole scheme of everything else.
As well. That's the key word. Awesome. This has been so amazing. Thank you so much, Ghazal, Gulrukh, for being part of Elevate, and it has been an honor to have both of you at the pod.
Thank you for having us.
Yeah, no,
I
thank
enjoyed
you
it.